Have you ever woken up in the middle of the night with a sharp, tightening pain shooting through your calf and wondered why it keeps happening night after night? A lot of older adults tell me the same thing. They stretch before bed, they drink water, they try to get comfortable, yet the cramp still arrives like an unwelcome visitor in the dark. One of my patients once shared a story that stayed with me. She was in her early 70s, healthy, active, careful about her hydration, and always proud of maintaining a balanced diet. But almost every night, just as she drifted into sleep, a painful cramp would rip through her leg and send her sitting straight up in bed. She kept asking, "Why does this keep happening if I'm doing everything right?" It wasn't until we looked closely at her bedtime habits that the real answer began to appear. I want you to imagine this for a moment. What if the root cause of your nightly leg cramps isn't your age or dehydration or even a lack of magnesium? What if it's something much simpler, something you do every evening without realizing it? The truth is that nighttime cramps are often triggered long before your head hits the pillow. Your muscles remember every position, every habit, every small tension you carry into bed. Most seniors assume cramps come from missing nutrients or overworked muscles, but the bedtime routine plays a far bigger role than people think. When you lie down to sleep, circulation naturally slows. Muscles cool and tighten. Nerves become more sensitive. A simple posture mistake or a small nightly habit can interrupt blood flow, irritate nerves, and set the stage for a cramp to strike. But let me reassure you, these cramps are not signs of weakness or failure. They are signals. Your body is asking for a little more understanding, a little more care, and a bedtime routine that truly supports it. In the next part, I'll show you the surprising mistakes hidden in many bedtime habits and how a few gentle changes can reduce or even stop nightly leg cramps. Before we continue, if this video is helping you already, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-changing content for you. Why leg cramps get worse at night? When we talk about leg cramps that strike in the middle of the night, most older adults nod with a quiet sense of familiarity. There is something uniquely unsettling about being pulled out of deep sleep by a sudden, intense tightening in the calf or foot. It feels unfair, almost as if the body waits until you're resting to send the strongest signals. But there is a reason night cramps feel different, and understanding that reason is the first step toward easing them. At night, your body moves into a restorative phase. Your heart rate slows, your blood pressure drops, and circulation naturally decreases. For younger adults, this gentle shift rarely causes problems, but after 60, the story changes. Blood vessels stiffen a little more, and muscles that once stayed elastic throughout the day begin to lose some of that natural resilience. When you lie down, blood no longer has the help of gravity pushing it toward your feet. Instead, it settles. Muscles cool, tighten, and become less flexible. Nerves that have grown more sensitive over the years become reactive in ways that surprise you. Many of my patients assume their cramps are related only to hydration or aging, but often the culprit sits in their evening routine. One patient of mine loved to unwind by watching television for hours before bed. She didn't realize her ankles were bent downward while she relaxed in her recliner. That small detail kept her calves in a shortened position for long periods, and every night the same story repeated. She would lie down, fall asleep, and wake up within hours with a painful spasm. It wasn't aging, it wasn't dehydration. It was posture and circulation working against her at the exact moment her body needed rest. Nighttime cramps aren't random. They reflect how your muscles, nerves, and circulation behave when you shift from an active day into a still, quiet night, and once you understand this pattern, you can begin to change it. The bedtime routine mistakes no one talks about. As I sit with patients and listen to their stories, I've realized something important. Most people don't recognize how their bedtime habits quietly set the stage for nighttime leg cramps. These habits seem harmless, even comforting, yet they create the perfect conditions for muscles to tighten, nerves to misfire, and circulation to slow down just enough for a cramp to strike. One of the most common mistakes is drinking too little water in the evening. Many seniors avoid fluids at night because they worry about waking up to use the bathroom. I understand that concern deeply. But when the body is slightly dehydrated, muscles lose the fluid balance they need to stay relaxed. A dehydrated muscle is like a dry sponge. It stiffens easily, reacts quickly, and sends sharper signals of discomfort. And when dehydration settles in before sleep, the risk of a midnight spasm rises dramatically. Another quiet trigger comes from eating salty or heavy dinners. A high-sodium meal can shift fluid out of the muscles and disrupt electrolytes. Your body works hard through the evening to restore balance, but if the imbalance remains when you lie down, the calves often respond with cramps. I've seen this pattern in countless seniors who never suspected their dinner plate had anything to do with their restless nights. Many people also love a hot shower before bed. It feels relaxing, soothing, and comforting. But muscles warmed by hot water tend to cool quickly once you step into bed, especially in a cooler room. That sudden shift in temperature can cause muscles to contract more easily. It's a small detail, but the body notices what we overlook. And then there's stretching. Some seniors stretch with their toes pointing downward, thinking they're loosening the calf. That single motion actually tightens the muscle instead of releasing it. When combined with heavy blankets that push the toes down during sleep, the calf remains in a shortened position for hours. These bedtime habits seem innocent, yet they influence your muscles long after the lights go out. Understanding them is the key to transforming your nights into something more peaceful. Foot posture problems before and during sleep. When I talk with seniors who struggle with nightly leg cramps, one pattern appears again and again. Their foot posture, both before bed and during sleep, plays a much bigger role than they ever imagined. Most people don't think about the position of their feet. We think about our back, our pillows, our mattress, even our room temperature, but the feet are often ignored. Yet they quietly set the tone for how the calf muscles behave throughout the night. The most common issue I see is something called plantar flexion. That sounds technical, but it simply means the toes point downward. You may do this without noticing, while lounging on the couch, while sitting in a recliner, or while drifting off to sleep. When the foot points downward, the calf muscle shortens. A shortened muscle doesn't receive as much blood flow, and it becomes far more sensitive to even the slightest nerve signal. That irritation can turn into a full cramp with just a small movement. Some sleeping positions make this posture even worse. When someone sleeps on their stomach, the feet naturally point down for hours at a time. In side sleepers, one foot often slips into an awkward angle where the toes curl downward. Even people who sleep on their back sometimes place their feet in a way that keeps the calves slightly tightened. These positions seem harmless because they're comfortable, but comfort doesn't always mean the body is supported. I once worked with a patient who did everything right. She hydrated, stretched gently, and kept her room warm enough. Yet she still woke up with intense leg cramps several nights a week. When I observed her natural sleeping posture, the answer became clear. Her ankles kept sliding into a downward angle during sleep. We made one small adjustment, and within a week, her cramps were almost gone. It's a powerful reminder that the smallest details in our nightly posture can shape how peacefully our muscles behave. Sometimes relief begins with noticing the positions we never knew we held. Circulation and nerve triggers. You overlook. When seniors tell me they experience leg cramps only at night, one of the first things I look at is circulation. During the day, gravity helps blood move down into the legs and back up again. But when we lie down, that natural assistance fades. Blood flow becomes slower and more dependent on the health of our vessels, the strength of our muscles, and the stability of our nerves. This is why certain problems stay hidden during the day, but appear clearly in the quiet hours of the night. Poor circulation doesn't always show dramatic symptoms at first. Sometimes it begins with cold feet that never seem to warm up under the blankets. Other times, there's a tingling sensation or a slight numbness that people brush off as just getting older. In reality, these sensations are gentle whispers from the body, warning that the muscles aren't receiving enough oxygen or nutrients when the body is at rest. And when a muscle doesn't get what it needs, it stiffens and becomes irritable, especially during the night. The nerves also play a powerful role. As we age, nerves become more sensitive. Things that wouldn't have bothered us at 40 suddenly feel significant at 60 or 70. When circulation slows down and nerves become increasingly reactive, the two work together in ways that make cramps more likely. Even a slight shift in posture can send a sharp, sudden message to the calf muscles. That message can be enough to trigger a spasm. I once treated a woman who believed her cramps were due to magnesium deficiency because she had heard that from friends. But nothing changed even after she began supplementing. When we looked closer, the issue wasn't minerals at all, but early signs of reduced blood flow to her lower legs. Once she focused on improving her circulation, her nighttime cramps decreased dramatically. These silent triggers are easy to overlook because they rarely make noise during the day. They wait until your body is still, your mind is quiet, and your muscles are resting. That is when the truth reveals itself. And understanding this truth is a crucial step toward reclaiming restful nights. Mineral imbalances that make night cramps worse. When seniors think about leg cramps, the first word that often comes to mind is magnesium. And yes, magnesium plays an important role. But what surprises many of my patients is that cramps rarely come from just one mineral. Instead, they often come from an imbalance among magnesium, potassium, and calcium. These minerals work together like members of a small orchestra. If one is too low or one is too high, the entire rhythm of the muscles can become disrupted. Magnesium helps the muscles relax. When magnesium levels fall, the muscles struggle to release after contracting, which makes them feel heavy, tight, or stuck. Potassium, on the other hand, helps the muscles contract smoothly. If potassium levels fluctuate too much, the muscle can suddenly lock, leading to a cramp that feels deep and unyielding. Calcium controls the spark that makes a muscle fiber fire. When calcium drops below normal, even slightly, the nerves misfire. That creates sharp, sudden, unpredictable cramps that often strike during sleep. And here's the part many seniors overlook. Medications change mineral balance. Diuretics, commonly prescribed for blood pressure or fluid retention, flush out magnesium and potassium through urine. Some antacids interfere with mineral absorption. Certain antidepressants or steroids shift electrolytes subtly over time. Even mild dehydration from drinking too little in the evening adds to the imbalance. The body is incredibly wise, but it needs the tools to function properly. When the tools are missing or mismatched, the muscles send clear signals that something is off. I remember a gentleman in his late 70s who took a diuretic every morning. He drank plenty of water, took daily walks, and kept a balanced diet, yet he still had cramps almost every night. His blood tests revealed low magnesium and borderline potassium. With his doctor's guidance, he adjusted his regimen, and within 2 weeks, his cramps were far less frequent. Mineral imbalances don't shout during the day, but they make themselves known in the stillness of the night. Understanding this delicate dance of electrolytes can make all the difference for seniors searching for peaceful sleep. Evening habits that secretly trigger cramping. As the evening settles in and the world grows quieter, the body begins preparing for rest. Yet this is also the time when many habits, gentle as they may seem, create the perfect environment for leg cramps to appear later in the night. These habits slip into our routines so naturally that most people never consider how they might be influencing their muscles. One pattern I see often is long periods of evening sitting. Whether someone is watching TV, reading, scrolling through a phone, or simply unwinding in a recliner, the legs remain in the same position for far too long. When the muscles stay still, circulation slows, and blood begins to pool in the lower legs. By the time the person heads to bed, the calves are already tight and undernourished. This tension doesn't always show itself until hours later, when the body is fully at rest and the muscle finally responds with a sharp, sudden cramp. Temperature also plays a role. A very hot shower can feel wonderful at first, relaxing the muscles and melting away stress. But when you step out into a cooler bedroom, the rapid temperature shift can cause the muscle fibers to tighten quickly. For some seniors, that quick contraction acts like a spark, setting off cramps during the early hours of sleep. Late evening exercise, like brisk walking or chores around the house, can also contribute. When a muscle works close to bedtime without being properly stretched afterward, it stays in a partially contracted state. Hours later, that unfinished tension turns into a cramp, often waking someone from deep sleep. Even clothing matters. Tight pajama bottoms, snug socks, or anything that puts pressure around the ankles or calves can restrict circulation just enough to irritate the muscle. It's a small amount of compression, but the body notices it. These evening triggers are subtle, almost invisible in real time. But together, they can create a perfect storm for nighttime cramps. When seniors learn to recognize these patterns, they begin to see just how many opportunities there are to calm the muscles long before the lights go out. The sleep environment that makes cramps worse. When people think about nighttime health, they often focus on mattresses, pillows, or noise levels. But I've learned over the years that the environment around your legs can be just as important as the environment around your head. The space you sleep in, the temperature you choose, and even the blankets you use can quietly influence how your muscles behave through the night. One of the most common culprits is a cold bedroom. Many of my patients enjoy cooler temperatures because it feels refreshing or helps them fall asleep faster. But muscles don't enjoy the cold as much as we do. When the temperature drops, muscles naturally tighten to preserve heat. A calf muscle that tightens through the night is far more vulnerable to cramping, especially in seniors whose circulation is already a little slower. The cold doesn't have to be extreme. Even a small drop in temperature can trigger a muscle that was already on edge. Blankets also play a surprising role. Heavy blankets often push the toes downward without people even realizing it. When this happens, the foot slips into plantar flexion, which shortens the calf muscle. You may fall asleep comfortably, but hours later, that shortened muscle becomes irritable, and the slightest twitch can turn into a painful spasm. I once saw a patient whose cramps vanished almost overnight when she replaced her heavy comforter with a lighter one that didn't press against her feet. Pillow placement can also influence nighttime comfort. Some people place a pillow under their knees without realizing that it angles the feet downward. Others rest their heels directly on the mattress in a way that slightly elevates the toes. These tiny shifts might seem insignificant, but the muscles feel every angle. A small change in posture can decide whether your calf stays relaxed or struggles through the night. Even lighting plays a part. Blue light from phones or tablets delays melatonin release, which keeps the nervous system more alert than it should be. A nervous system that doesn't fully settle will send more reactive signals to the muscles, increasing the chance of nighttime cramps. The sleep environment is a quiet but powerful teacher. When we adjust it thoughtfully, our muscles respond with the peace they have been waiting for. The perfect bedtime routine to stop night cramps. Creating a bedtime routine that protects your muscles is one of the most powerful ways to reduce nighttime cramps. And the beauty of it is that it doesn't require expensive products or complicated exercises. It simply asks you to be intentional with the way you prepare your body for rest, offering your muscles the care and signals they need to release the tension built throughout the day. One of the simplest steps is to give your body a small amount of hydration before bed. Not a full glass, and not so much that you'll be waking up repeatedly, but just enough to support muscle balance. A half cup to 1 cup of water about an hour before bedtime can make a quiet but meaningful difference. The muscles rely on fluid to maintain their electrical stability. When they're properly hydrated, they're far less likely to misfire in the middle of the night. Minerals also play a key role in your nighttime routine. Adding magnesium-rich foods earlier in the evening or using a gentle magnesium lotion can help ease muscle tension. Many seniors tell me they feel their calves soften within minutes after applying it. The goal is not to overwhelm the body, but to give the muscles exactly what they need to transition into rest. Stretching before bed is another powerful tool. I'm not talking about dramatic or intense stretches. Instead, think of it as a 2-minute conversation with your calves. Soft, slow movements signal the muscles to lengthen and relax. When you stretch in a calm, controlled way, you're reminding your body that it's safe to release. This alone can prevent hours of trouble later. Warmth can help as well. A quick, warm compress around your feet or calves for 1 to 2 minutes is often enough to increase circulation gently and soothe the nerves. It tells your muscles, "You're done working for the day, let go." Your sleeping posture matters too. A lighter blanket, feet resting in a natural neutral position, and avoiding anything that presses your toes downward can spare your calves enormous strain. If you sleep on your back, allow your toes to naturally lift rather than point downward. If you sleep on your side, try placing a small pillow between your legs to maintain a more neutral posture. This kind of bedtime routine isn't just about preventing cramps. It's about giving your body the nourishment, time, and attention it deserves after carrying you through another day. And with these simple steps, your nights can become calmer, softer, and far more comfortable. What to do when a cramp strikes at night? No matter how careful you are, there may still be nights when a cramp finds you. It can happen suddenly, catching you right in the middle of deep sleep. One moment you're dreaming, and the next you're sitting upright with a bolt of pain running down your calf. If this has ever happened to you, I want you to know that you're not alone, and more importantly, you can regain control in those moments. The first step is to breathe. When a cramp hits, many people panic without realizing it. Their heart rate jumps, the body becomes tense, and the muscle tightens even more. Slow, steady breathing helps soften that reflex. Inhaling gently through the nose and exhaling through the mouth reminds the nervous system that it's safe and that the body can begin to release the spasm. The next step is to guide your foot upward. Instead of pointing your toes down, which makes the cramp worse, gently lift your toes toward your body. This movement lengthens the calf muscle and interrupts the contraction. You don't need to force anything. Think of it as coaxing the muscle out of its tight grip. Some seniors find relief almost instantly when they make this small adjustment. If the cramp doesn't ease right away, placing your foot flat on the floor can help. The firmness of the ground gives the muscle a stable surface and signals it to relax. Standing up slowly with the foot pressing gently into the floor often helps break the cycle of the spasm. Once the cramp fades, massage can soothe the lingering soreness. Use light pressure, moving your hands in smooth motions along the calf. Harsh or aggressive rubbing can irritate the muscle even more, so be kind to yourself in this step. After massaging, a warm compress placed on the area helps restore circulation and calms the nerves. The key during a cramp is not to fight the pain, but to guide the body through it. With small intentional actions, you can shorten the intensity of a cramp and help your muscles trust you again. These gentle steps can turn a frightening moment into one you can handle with confidence and calm. When bedtime routine is not the only cause. Even though a bedtime routine plays a powerful role in stopping nighttime cramps, it's important to recognize that it isn't always the whole story. Sometimes the body sends messages that point to deeper issues, and listening early can make all the difference. I always remind my patients that leg cramps are not a personal failure, but they can be a clue. When the same cramp returns night after night, or when it feels sharper or more persistent than before, it's the body trying to guide us towards something that needs attention. Circulation problems are one of the most common hidden contributors. When the arteries in the legs stiffen or narrow, even slightly, the muscles struggle to get the oxygen they need, especially when you lie down. The result is a tight, irritable calf that is more prone to cramping. This can happen long before someone notices changes while walking or standing. In fact, nighttime cramps are often one of the earliest signs of circulation changes in older adults. Underlying nerve issues can also play a significant role. Conditions like peripheral neuropathy, diabetes, or sciatic irritation cause the nerves to fire unpredictably. These misfires become more noticeable at night when the body is still and quiet. I've had patients who blamed their cramps on dehydration for years, only to discover that nerve irritation was the real cause. Thyroid disorders, vitamin deficiencies, anemia, and even subtle changes in kidney function can influence muscle behavior, and medications are another major factor. When a new prescription is added, or when the dosage of an existing medication changes, cramps may appear as a side effect. Diuretics, blood pressure medications, antidepressants, and statins often shift minerals or irritate muscles in ways that lead to nighttime discomfort. What matters most is paying attention to patterns. If cramps are becoming more frequent, lasting longer, or appearing alongside swelling, numbness, coldness, or weakness, it's time to speak with a doctor. These symptoms are not meant to frighten you, but to guide you. Most underlying causes are manageable when addressed early. Your body is always communicating with you. When you listen to these messages with patience and curiosity, you give yourself the best chance at long-term comfort and health. Bringing it all together. As we reach the end of this journey, I want to bring all these insights together in a way that feels empowering and clear. Nighttime leg cramps can be frightening, frustrating, and exhausting, especially when they return night after night. But the truth is that they are rarely random. They follow patterns. They follow habits. They follow the small things we overlook in the quiet moments before we fall asleep. And once you begin to understand those patterns, you take back control. Throughout this conversation, we've explored how the body behaves differently at night. We've looked at the roles that hydration, minerals, circulation, and nerve stability play. We've uncovered the impact of foot posture, evening routines, and even the environment around your bed. All these pieces may seem small on their own, but together, they create a powerful picture of what your muscles experience while you sleep. And the most encouraging part is this: almost every cause we discussed is fixable. You don't need to accept nightly cramps as an inevitable part of aging. You don't need to feel powerless when a spasm wakes you from a deep sleep. Change begins with awareness. Relief begins with understanding. Healing begins the moment you start supporting your body in the ways it has been quietly asking for. I've seen seniors in their 60s, 70s, and 80s transform their nights simply by adjusting posture, staying gently hydrated, stretching with intention, or identifying the habits that were tightening their muscles without them realizing it. These changes don't require perfection. They only require noticing. They only require care. Your body has carried you through a lifetime of steps, strength, and resilience. It deserves comfort. It deserves peace. And it deserves a night's rest without pain. If this video has helped you understand your health more deeply, I truly hope you'll subscribe, like, and share Senior Health Daily. Your support allows us to continue guiding you with clarity, compassion, and knowledge you can trust. You're not alone on this journey, and together we can create nights that feel calm, steady, and free. As we reach the end of our time together, I want you to take a slow breath and remember something important. The leg cramps that have been interrupting your nights are not signs of failure. They are signals. Your body is speaking to you in the only language it has, asking for care, for attention, and for gentler habits that support its strength. These moments of discomfort are not meant to scare you. They are meant to guide you. Your legs have carried you through a lifetime of memories. They have walked you through work days, family gatherings, moments of joy, and moments of heartache. They have supported you through every stage of life without asking for much in return. After decades of loyalty, they deserve patience. They deserve compassion. They deserve kindness instead of frustration or judgment. The beautiful truth is that improvement is always possible. Whether you are 60, 70, 80, or beyond, your body is still capable of healing in small, meaningful ways. A little more awareness in your bedtime routine, a gentler posture, a few extra minutes of stretching or hydration, or simply noticing the early whispers before the cramps begin, can create a tremendous difference. These might feel like tiny adjustments, but over time they can bring back the peaceful nights you've been longing for. Your body is not your enemy. It is your lifelong companion. And the more you listen to it, the more it supports you in return. Your health is a lifelong relationship. Treat it with patience, curiosity, and love. If this video has brought you clarity, comfort, or hope, I warmly invite you to subscribe, like, and share Senior Health Daily. Your support helps us continue creating guidance that keeps you safe, confident, and connected on your journey to better nights and a healthier life.